St. Elizabeth Physicians was just formed through the merger of two large physician groups a little over 5 years ago in the northern Kentucky area. We had inherited quite a diverse inventory of used phone systems. It's old aging equipment that tends to die a lot. It's a very poorly designed, there's no common platform. The idea of putting together a premise-based phone system and a support organization for 98 offices over 3 states, it seemed like a pretty monumental effort. So what really drove us to moving to the cloud-based platform was we wanted to avoid that high upfront cost. We had to get it done quickly. We wanted to have access to a state-of-the-art phone system, and we needed a good support solution that could allow our small IT department to stay focused. We went with a cloud-based solution because it fit our DNA of what we were looking for. By working with the cloud vendor, they could put together the resources to where we cut over 57 offices and did it in a timeline of about 8 months. Since we've made the migration to a cloud-based platform, we have many new tools available to us. For example, we have 2 offices in Aurora, Indiana. One of them is a very large office, one's a 1-doc office, and he's closed on Fridays. So on Fridays, he still wants to be able to take calls from his patients to schedule appointments and answer clinical questions. In the old world, I'd have to hire another staff person to come in on Friday to pay that person to cover the phones. In the new world, I just set it up to automatically divert those calls to the Aurora office. The calls show up at the Aurora office marked as Hidden Valley. They can answer the phone as Hidden Valley. They have access to the EMR records. They can schedule the patient's appointments. They can answer the questions. And in most cases, the patient doesn't even know they're talking to somebody at a different office. One of the things we were able to do once we had all the phone offices up and running on the new platform is put together plans for disaster recovery. With West IP, we were able to partner up offices with primary care to primary care, heart and vascular. So if we did have a fiber cut or a major power loss at an office, we're not going to lose that call. We can quickly contact West IP. They know who the partner office is for each of our offices, and within minutes they can start diverting those calls to another office. The end result of that is we were very comfortable with our solution, and the other result is I sleep very well at night. The other initiative that we're starting this year is the development of large call centers. Initially, when we migrated to West IP, each individual office had their own resources and their own little call center. The problems that we see with this are some offices are properly staffed to handle the call volume, others aren't. In the days before moving to West IP, most customers were confined to the 4 walls in their office. With the new West IP platform now, I can give them resources outside their office. So what we're looking to do is pull these resources out of the office, create these large call centers where we can have standardized processes for scheduling patient appointments and standardized processes for doing the patient referrals. And by pulling those people out of the office, the people that are left in the office could then be focused on that next patient walking in the door to provide them the highest quality of care possible.